I think that what Professor Shakman is saying is very valid, and at the same time I have to salute our dentists like Dr. David Kennedy, who travel the world and spread the news about mercury and fluoride, because it's a very brave thing to do, and it's very noble. And thank you for that, David, really, for everyone. Pat him on the back. Everyone clap him, okay? Okay, now we have our cleanup doctor, Dr. Hans Gruenn. Thank God we have him around. Dr. Gruenn is most probably the most experienced, what do we call you, integrated alternative medical physician in town that understands mercury toxicity and works with mercury detoxification and heavy metal detoxification. And it's my pleasure to introduce him to you.
Thank you, Francine.
Thank you.
Now, the question is, if mercury is so toxic, why don't more doctors do something about it? I mean, mercury is the second most toxic heavy metal in the universe, or element in the universe. Extremely toxic, more than cadmium, more than arsenic, more than lead. Why doesn't anybody do anything about it? And this kind of perverted paradox situation shines a whole light on how medicine is done in our country, how Western medicine is done in general, which is actually which has a focus on acute disease. So if you swallow a fever thermometer, medicine won't have problems with that. An acute emergency, and everybody understands acute mercury toxicity, and you get, if you can be saved, the best possible care. Now, if you intoxicate yourself by breathing your own amalgam fillings, the mercury from your amalgam fillings over years and years and years and years, and decades and decades and decades and decades, and you end up with a significant mercury load in your body, and that potentially influences your longevity, your vitality, and basically potentially every organ system in your body. We might call that natural aging. We might call that something we cannot prove, and it's not easy to prove it. So we don't have scientific models that say, well, a little bit of mercury, or even a little bit more, as you heard, on a daily basis over 30, 40, 50 years, what does that do to us? Besides lifestyle, environmental factors, stress, what have you. Scientifically, very hard, impossible to prove. There's no doubt mercury gets in our body because we know it from the corpses. But then the doctor says, well, okay, you have the idea, you have some mercury in your body. I don't know where you have it from some crazy doctors. Let's see whether it's true. So let me take your urine, okay? I take your urine, check it, send it to the lab, toxicological lab. Look here, nothing. I take your blood, and unless you recently had some dental work done, or recently ate a significant amount of fish, the blood will show nada, nothing, okay? What more do you want? Urine, blood, nothing there. And here's where the whole drama starts, because the stuff is so toxic because it gets into our body, it's deposited in our organs, and it doesn't come out. If it would come out spontaneously with the urine, we wouldn't have a problem with mercury. Obviously, we just pee it out, but we don't. All right, so that's the whole dilemma. Let me take you a little bit through a journey on the medical side. So the dentist put it in, and you have to be aware that in general, 80% of the mercury that ends up as your mercury body burden comes from dental amalgams. So short of people who are occupationally exposed, or short of people who have, like the poor fishermen in Japan, Minamata Bay, have the misfortune to eat fish that is extremely contaminated with mercury. 80% of your mercury comes from dental amalgams. You breathe it in. That's actually the most relevant form of uptake. It goes through your lungs. It's basically close to 100% absorbed through your lungs. If the dentist drills it out, that's where it happens. Okay, so you think you get rid of a bad thing. In reality, you expose yourself significantly. And we can see that. I, for example, do a little technique called biological terrain assessment, which looks how acidic your body is, and amongst others, It looks also gives some kind of idea about the concentration ability of the kidneys. You know, and sometimes I have people who have no concentration ability in their kidney. What happened? I was a dentist 3 weeks or so. I hear that over and over again. Yeah. So despite the fact that the kidney doesn't break down totally, we damage our kidney reversibly. The body can repair that after months, but we do. So okay, we inhale it. It gets basically into our whole body, into every organ, and there is not a single organ that it doesn't go. From the brain, which is specifically vulnerable, and there's a direct nerval connection to the nervous system into the brain. There's a direct connection with the first brain nerve, the olfactory nerve. If you inhale, mercury actually directly, by direct connection, gets upstairs, okay, and stays there. And you might turn a little bit more irritable, you might lose your short-term memory, you might fight more frequently with your wife or with your colleagues or with whomever. You might get anxiety or depression, but for that we have psychiatrists. There is a guy who called Donder, Professor Donder in Munich, who is a toxicologist at the University of Munich. And he started out 35 years ago, he just retired last year. He started out as a mainstream, very clever guy, a toxicologist. So he started getting into this whole mercury issue. And so after years and years, and down the road, 10,000 people of studying and researching, the guy turned into a radical, into a politically active radical, who basically says 80% of all diseases are co-caused by mercury. 80% of all diseases are co-caused by mercury. He totally went overboard, tells everybody to sue their dentist, tells we have to stop that however we do it. Okay? That's how radical the guy is. Now, do we have total proof for that? No, we don't. Is this a reasonable opinion? Yes, it is. All right, brain. It gets into your connective tissue, fibromyalgia. The other day I did chelation therapy, a few sessions with a patient with fibromyalgia for 10 years. After the second session, which is really amazing because normally it doesn't go so fast, she says, listen, that was the first 3 weeks I did not have pain when I get up in the morning. It gets basically into, let's continue with heart disease. Heart disease killer number one. There is, as you probably know, there's this French paradox, which means which says why don't the French have more heart disease? Well, because they drink alcohol, and red wine contains 5 flavonoids, which are antioxidants.
A lot more fat.
Despite, well, and bad fat. So I'm not so clear on the fat, but there is a Finnish paradox. Okay, and the Finns eat tons of fish, healthy fat, omega-3 fatty acids, tons of fish. But they have one of the worst rates of heart disease in Europe, and they did a study with more than 1,000 people, Finnish men, and they found that men who had a high level of mercury in their system had basically double the risk of suffering a heart attack. Double the risk of suffering a heart attack, 50% up, or 100% up, sorry. So, how does this go? Well, mercury is an oxidizer, okay? It oxidizes, yes, it's a free radical, it's radical. And it oxidizes your LDL, and you probably know the whole LDL and cholesterol controversy has something to do with bad cholesterol, and bad cholesterol, not only bad cholesterol, but oxidized bad cholesterol. And what does that? Amongst others, mercury. Okay? So you would suddenly have then this LDL, which then eats holes into your cellular wall, and here you go. Arteriosclerosis and heart attack at the end of the story. It goes into the hormonal system. David yesterday told a wonderful story where he took the amalgam fillings out of his dental assistant who wanted to become pregnant, couldn't for years, and suddenly she was. Yeah, and it was his fault. Hopefully only in one way.
I put him back in. Whoa, David.
There are people, you know, for example, the whole hypothyroidism business mercury is in the thyroid gland. Mercury blocks the conversion from T4 into the most active thyroid hormone, which is T3. Mercury goes into all the organs. Mercury causes chronic fatigue. Mercury causes autoimmune diseases, okay? Now, why is that happening? Well, mercury hooks on to sulfur-containing amino acids. Our proteins are long chains of amino acids, which then suddenly are structurally changed and appear foreign to our immune systems, which attacks it. Okay, we have a huge surge in autoimmune diseases, and nobody knows why. It's one of these things. Yeah, mercury is one of the reasons. Now, back to biological levels. I said mercury is a free radical producer. At the same time, mercury blocks antioxidant enzymes. Okay, if we have much free radicals, which we are exposed with our lifestyle and our environment and stress and drugs and toxins and no exercise and what have you, or extreme exercise, at least we can take antioxidants. Yeah, but the tricky thing is mercury does it both. It damages you in terms of free radicals, and it prevents your superoxide dismutase, catalase, glutathione peroxidase to function. And the body has very, very little remedies to get rid of mercury. Half-life of mercury in certain tissues in the brain, for example, is 18 to 20 years, which means if you do not get any mercury in, which is very difficult, over 20 years, after 20 years, you still have 50% of what you had before. Okay? And there are people whose, I mean, like everything, this is biologically determined. There are a few people who fare better, and there are a few people, probably 25% of the population, who fare worse because they don't have these enzymes. Yes?
You can't find out your mercury count through the blood or urine. How can you?
I'll tell you in a moment.
Can we hold all the rest of the questions for another 5 minutes and let Dr. Willis finish?
Okay, so it stops, it blocks and reduces your antioxidants. And you can eat all the antioxidants in the world, you're not really catching up because these intracellular antioxidants, superoxide dismutase, are really the big players in the field. Even worse, the body normally has an ability, there is mercury and the body defends itself, it upregulates its glutathione production. Glutathione is one of the sulfur-containing triple amino acids which has a protective effect against mercury. But the brain, and that's why the brain is so vulnerable, doesn't have this ability. Okay? So mercury gets in the brain is without any defense. And we do know, again from autopsy, that all the major degenerative neurological diseases, from Lou Gehrig's to Parkinson's to Alzheimer's to MS, have increased mercury levels in their brain. Does this mean mercury causes that? Well, it is a cofactor for sure. Nothing, unless in extreme concentrations, and that's more than acute mercury picture, causes. But if you have genetic pattern, you have nutritional patterns, you have lifestyle factors, you have mercury, if various things come together, you are vulnerable. Okay, so basically there is no organ and no disease that cannot be co-caused by mercury. Now, how do we get rid of it? First of all, how do we diagnose it? Blood sometimes shows something, but more of an acute exposure, fish or recent dental work. Urine is worthless in most cases, at least spontaneous urine. So hair is a good tissue. Hair is intracellular, you can look inside the cell, so to speak, and hair is an excretory organ, it excretes things, so often it shows up in hair, and toxicologically that's a valid procedure. Okay, so if you have mercury in your hair, whether it's a little bit or a lot, doesn't really matter, you do have mercury in your body. If you have no mercury in your hair, you most likely, and with a good chance, still have mercury in your body. And the way we can test for it is by doing so-called challenge tests with so-called chelating agents, which are medications which hook on through two chemical bonds to the mercury and carry it out to the kidney. Yeah, chelation comes from chelos, the word Greek. In Greek means claw. They hook on, and then you can measure it in the urine. Okay, you collect the urine for 6 hours or 24 hours or whatever you want to do, and send it to toxicological lab. And surprise, surprise, there's some arsenic, there's some cadmium, there's a little bit of lead, and normally, and with people who go through this procedure and are aware of this and concerned about this, there's often significant amounts of mercury. Now, some of my patients come back and, they have a huge spill. Others come back and they have a small spill. Now, the spill alone doesn't tell you how much you have in your body. It only tells you how much comes out of your body. You have to understand, right now we have no method of really proving how much mercury total, micrograms or whatever, do I have or you have in your body right now. We only can tell you what comes out. Okay, so if a certain amount comes out beyond a certain limit, what we consider normal, there should not be any mercury in our system. So normal is actually already an euphemism and a definition which the toxicologists do, because otherwise they would have to declare everybody as sick or pathological. So if a lot comes out, it means you let go a lot. If a little comes out, sometimes when people are very sick, for example, someone has chronic fatigue, they are depleted over years, they have low energy, they do all kinds of therapeutic trials, they do not get better. These are often people who are full of mercury, but it doesn't come out. Even with DMPS or other chelating agents, the spill is very small. So even chelation therapy in certain patients has their challenge, because it needs not only the chelating agent, but also the detoxification ability of your own body. And that has something to do with lymph flow and blood flow and antioxidants and what have you. Okay, and if this is all down, then you have more problems. These chelating agents, let me talk about this a little bit. There are a few ones. One is called DMPS. The short little chemicals, look like amino acids, have normally two sulfhydryl groups, sulfur groups. Sulfur and mercury go together. An old method of getting rid of mercury toxicity was eating lots of eggs. Okay, eggs stink when you let them. This is the sulfur, and they hook on to mercury and are able to carry it out. Garlic, to some extent, has the same function, but it also has sulfur-containing amino acids. So that's what we use therapeutically. DMPS is one form, which is originally, or the form we use at least is a German medication. There's an American medication called DMSA, which is an oral medication. It's not quite as active and is not quite as good to make this challenge test, okay, so that you can really we can diagnose mercury toxicity. All right, so we would do one of these tests, we would send it in, you get your result, you have a certain level of mercury, and then you basically would repeat that procedure. But it's not only chelation therapy, it has its caveats. You have to make sure that the person has enough minerals, for example, because chelation therapy not only pulls out heavy metals, it also pulls out some of the healthy minerals, zinc, copper, manganese, for DMPS, for example. So you have to make sure that this person has lots of minerals, otherwise you have more detoxification, okay? David last night talked about fluoride, and he had these extreme cases in China with fluoride, and they were exposed to levels that are similar to levels we're exposed to, but they had more symptoms. Why? Because they were mineral depleted. Yeah, they had low levels of calcium and other minerals, and that is the fact. Yeah, if your minerals are down, the toxicity of these heavy metals will be more. Okay, so it's always very important for you to mineralize yourself well, especially during this chelation therapy. There are some nutrients that work and have a supportive factor. For example, chlorella, which is like all yeasts or algae able to bind some mercury in its cell wall. And, there's an old saying in German medicine, if someone has repeated yeast, candida infections, don't treat candida, don't treat yeast, treat mercury. Okay? Because the recurrent yeast infections, in that kind of thinking, in that rationale of the body, are a benign attempt of the body to rid itself of mercury. Okay? And the yeast, from a body perspective, is harmless, but the mercury is not, and that's one way of doing it for the body. And that's often true, not if someone has occasional yeast infection or so, but with people who have recurrent yeast infections, and you do everything and repeatedly and diet and antifungals and what have you and lifestyle, and eventually you have to address the mercury, and many, not everybody, but many people do get better after that. So you base the therapy then is to do this chelation therapy with a good support, and it depends how sick you are. The more sick you are, you need more support: lymph drainage, colonics, exercise, mineral infusions, what have you. Okay, very important. And then you go normally 5 to 10 to 15 times. It depends how much burden you had, and then finally you see in your urine nothing or very minute amounts only show up anymore, and then you are free of mercury. Thank you.
Okay, now we can take some question and answers. Yes.
Can we talk about anything, or is it just got to stay with mercury, what you last talked about?
Ask me about fluoride.
Okay, what I want to ask about is, what do you do with people like me? I didn't have my wisdom teeth taken out. One dentist said I had enough room, one didn't. I believe the guy who said I had enough room, and I didn't quite. And the pressure cracked 2 of my teeth, just the pressure. And I have a cracker and a cracker for about a year. This one's finally getting dark, and I'm wondering how long does it take for something to get infected, because I have no pain, and what do I do to fix an actual cracked tooth where you can actually see like a little hole in one ear? He's smiling, and I don't have any, does not having any pain mean it's worse? Or what's the best kind of thing, because I don't want to have a root canal if I don't need it. And the tooth might still be alive, and it just, I don't know. Just,
okay. Are there fillings in the teeth that crack?
No.
Okay. If the tooth is a healthy tooth, and that sometimes you get lines in teeth anyway. Everybody that has ice cream and coffee will have cracks in the teeth. There are people that have really lots of cracks in their teeth. There are people that jog in the winter in Minnesota, because they're sucking all that cold air by their teeth, and the inside of the tooth is 98.6, and Minnesota is minus 98.6, and the expansion, contraction, and so forth, and it exceeds the enamel's ability to do that. And you can get visible cracks. Those are not necessarily avenues for bacteria to invade the tooth.
Mine's a little dark now. So
well, I understand that. The stain will get in there, fluid will get in there, but it doesn't necessarily rot the tooth. Hal was going to say take the tooth out. I tell people, if the tooth is dead, it's kind of like if grandma dies. You got 2 choices. You can either bury her or have her stopped. Root canals, having her stopped. And actually, in root canals, a lot of times they use some of the same chemicals that they do in stopping animals, formaldehyde and so forth. But I seriously doubt that a crack that is caused by a minimal pressure from an erupting wisdom tooth is going to devitalize the tooth. Now, it might allow tooth decay to invade, and if that's not corrected, eventually that will kill the tooth.
Yeah, I've waited for about a year, so that's what I'm worried about.
Procrastination for you.
Tell me about it.
That old Hippocrates said, show me the health of a man's mouth and I'll tell you the health of his body. So anyway, get you to a good holistic dentist. And you know what a holistic dentist is? A person drills holes in things. Anyway, get you to a holistic dentist and have somebody look at it.
Are you in the LA area?
No, I'm not. I'm not here to generate patients. So.
Sorry, we have a full list of mercury-free dentists at our booth downstairs,
Yes.
and everyone almost except we have many books.
You're required to come to the booth anyway, because we've got the free stuff with it.
If you have a tooth taken out, like say that I did have to, I hope I don't, because that's like probably worse than losing a hair or something. But what have been the effects? I remember her talking once about a year ago, and there's other effects they were saying when people have their tooth taken out, where it really seems to affect the body in other ways, so there's that side.
Yeah, well, whenever you take a tooth out, you have a wound in the body, and it can develop an infection in the jawbone. So, it doesn't, because you have surgery doesn't mean it has to heal. You can get a jawbone infection just from the extraction of the tooth. So it's kind of in a situation where you're damned if you do, damned if you don't. But
do the implants work like I just made them out of coral?
implants are foreign objects. It's like, Igor, Frankenstein monster, had the rod sticking out of his head. That doesn't work. And so if the skin doesn't work, how do you think your mouth is doing? Duh. So, they're always infected to a certain degree. So, you don't want foreign objects. You are a sack of water. Skin over the whole thing, carrying a bunch of water around, which is your life. You don't need holes in the sack. And that's the real problem. The way a tooth comes through the sac naturally is the bone, the root, with a hard shell on the outside called enamel. And what we're trying not to do is to penetrate that sac, whether it's, with a bullet or a scalpel or a drill. So you want to keep your sac in, because you can take your hand, stick it in a bucket of doo-doo, and you don't have any bacteria in your bloodstream, because they don't get through that sac. But if you have a cut on your finger, you'll have stuff all through you. So that's the problem. You try to minimize that, and if you do have a cut, you sew it back together and seal it up.
Yes. How about Shakman wants to add something?
Yeah, I think and I'm not sure the answer, but I think the question of whether you have discoloration. Some of the people that I have studied said if a tooth is discolored, you got a problem. So. It's and the other, okay, it's number one. Number two, question of symptoms. It's been emphasized that the symptomless infections may be the worst, because when you have a symptom, that means that your body's resisting it. If you have no symptoms, that means that if there is an infection, it's going right into your bloodstream. So you're not resisting. So there's nothing backing up. So that's another thing to keep in mind. I want to just mention one thing about building on what Dr. Gruenn said here, of all the correlations with mercury. One thing that Fisher and some of the others spoke about was that what mercury does, if you put it in anywhere, it's going to kill the tissue. So when you kill the tissue, then you have a place where bacteria are more likely to be. So that one way that mercury, and maybe the principal way that contributes in terms of, if you look at it, just it's not really technical, but just from the outside, it kills tissue. When you got dead tissue, then you're going to have more of an infection. So that's one way that it kind of relates to the bacteria that's been linked to these different things. And then the last point to raise, and just on what Dr. Kennedy just said about the Frankenstein monster with the metal sticking out of the brain. Well, if we start to view the jawbone and the tooth and the jawbone as part of one unit, whether you've got that piece of that metal sticking directly out of your jawbone, or it's sticking out of your tooth, we have to raise the question: is there really a difference? And I don't know. I get a little confused. I don't really see the difference of whether you have metal, call it whatever it is, or whatever, sticking out of your tooth, or it's sticking directly out of the jawbone. Basically, it's just a little more circuitous to get into the bloodstream, but it's basically the same problem. That's all I had to add.
Thank you.
Sorry.
Next. Yeah. Are you directing this question to me? Well, I'm the one with the list for dentist. Well, then I have to go into what I do, and I only want to take a minute because, frankly, I think that the doctors are far more valuable to you than I am at this today, right here and now. I do lectures twice a month at Whole Foods and Wild Oats, and I have been doing lectures for 5 years and researching for 13. I have built a network, including Dr. Gruenn is on my network, and Dr. Kennedy, and many other, about another 15 or 20 physicians, dentists, and practitioners that are all familiar with the safe removal techniques of mercury filling and the very best possible techniques we have of removing mercury and heavy metals from the body. In my meetings are support groups. If there was a complaint about the dentist I have on my list, I would hear about it very quickly. In fact, my list comes with a guarantee. If any patient is upset with anything that they experience with any of the dentists or physicians on the list, I will personally take care of that. I will talk to the dentist, I will talk to the physician, and I will clear things up and help you through that. But no one on my list, literally no one on my list has ever been hurt by the dentist or physician. It's a very, very high standard that I hold, and a lot of integrity I hold, and a promise that I keep to people that they're safe, because I got very, very badly damaged many years ago, and that inspired me to do this work, and I know the importance of safety in this journey. That's the best I can do.
And I'll give you an answer on that, is that basically if they're licensed to practice dentistry in the state of California, they're allegedly regulated by the California Department of Consumer Affairs. State Board of Dental Examiners. Generally, the State Board of Dental Examiners functions as an auxiliary to the trade association, the California Dental Association, and they attack dentists that oppose the policies of the California Dental Association with the laws of the state of California, which is called restraint of trade. As I recall, the San Diego County Dental Society lost a fairly large lawsuit against the early HMO. Back in the 70s, they didn't want to have HMOs, and so they basically tried to foster